Good morning, everybody. And now, Ms. Barami.
Good morning, my lord. Today we have 4 witnesses. The first witness is Alison Walker.
Thank you very much.
Thank you. And for the record, her statement reference is SCI WT 0427501.
Do you happen to know if it's Miss, Ms, Mrs. or anything else?
I believe it's Ms. But I'm not
Right,
sure.
Ms.
No,
Okay.
Ms. Yeah.
I don't think so. Oh, dear me. So I've made the error now.
No, not at all.
No. Good morning, Ms. Walker. Now, there's a slight problem, a technical problem with a potential breach, which we've got to cut out of the transcript that's taken the whole time. So we'll have to wait a moment or two before that's sorted. I'm not sure if that was my fault, but if it was, I apologise.
I'm not quite sure.
I'm not sure of that. It's all right, no problem. Good. Now, Ms. Barami.
Good morning, Ms. Walker.
Morning. Morning.
Please, could you confirm your name for the record?
Alison Walker.
Thank you. And the inquiry has your details. You're a freelance sports journalist.
Yep.
And you've given a statement to the inquiry regarding your mother and father.
Yes, and my brother.
And your brother, sorry. Yes. There is a restriction order in place, so please don't mention any of your relatives' names, any of the care homes or hospitals that they were in, or any of the people involved in their care.
Yep.
Okay, thank you.
I understand.
By name. Thank you. Now, your mother and father were residing in a care home when the pandemic started, is that right?
Yep, that's correct.
Your father had been diagnosed with vascular dementia in 2012,
Yep.
And that was the reason he'd moved into the care home. But prior to that, he'd been in a respite home.
It was the same home, though.
Oh, it was the same home?
Yeah. The respite home was the same as the care home
Right,
that
okay.
he moved into initially without my mum.
Ah, okay, thank you. And in 2015, your mum developed mild Alzheimer's, but she didn't have an official diagnosis. And there was also no medical reason at that point for your mum to be in a care home.
No.
But because it was rare for there to be 2 places in that particular care home, and because of the effect of separation on your mum from your dad, it was decided that it would be a good time for them both to move into that care home.
Well, she largely decided it. It was up to her.
Yeah. The separation, the time that your mother and father were separate from each other while he was in respite had really had an effect on your mother, is that right?
Yeah, terrible effect. She missed him terribly. She missed looking after him. She just missed every aspect of him. They'd been together at that point about 57 years.
Okay, 57
and they were
years.
devoted to each other and did everything together. And she couldn't bear it, and she was frightened on her own. She was frightened on her own. She couldn't understand. She would phone me up in the dark and say, "Is it 9 o'clock in the morning or is it 9 o'clock at night?" Mm-hmm. So we knew she was really struggling on her own. She'd barricade the door and wouldn't let anybody in because she was so frightened. So she missed him.
Yeah, thank you. And in paragraph 8 of your statement, you say that you'd seen a decline in your father when he moved into a respite home, from the time he moved into the respite home. So when they both were in the care home together, you made a conscious effort to try to keep them on the ball.
Yes, and that was really important. I think our family learned a lot about dementia, firstly through my dad's condition. Mm-hmm. We learned that actually family contact, socialising, getting them out, getting them to do things, getting them walking, getting them moving, engaging in reading newspapers, mm-hmm. Helping them along, talking to them. We knew how important that was to keep. I mean, dementia is a chronic condition, mm-hmm. And stability, to keep some level of stability in dementia, it's important to have that regular, familiar family contact, hugging, touching, socialising. It's absolutely critical, because the window of opportunity before that closes, you know it's coming, because we saw it with my dad. So we knew, especially with Mum, that we had to keep that contact going for her in particular. That was absolutely critical to her health and well-being, and the families as well.
Yeah. And it was in the belief that that could be kept up that she went into the care home.
Yeah, and you know, that first year she was in the care home, I even took her to Wimbledon. You know, that shows the level of cognitive ability she still had at that stage, and that was and we took her swimming, we took her walking, we took her out for lunch, and engaged a lot with my dad when we came back. So we kept her relatively stable. Maybe I didn't see the decline as much because I saw her quite a bit, and others who visited less frequently in the family saw maybe more of a decline. But we managed to keep her fairly stable those first 2 or 3 years.
Thank you. Now, in mid-March 2020, the care home told you that for a while residents would be allowed to mingle and mix, the care home was closing to visitors, and that was before the national lockdown. Is that correct?
It was, and I was away working, and I missed actually seeing them on the final day that it was allowed. But we still thought it was only temporary, and I thought that's great. The care home have done what they should do. There's an infectious outbreak, you know, like novovirus. You know, we would never go in if we had colds or coughs or anything anyway, because families just didn't do that. If you had a relative, an elderly relative in a care home, if you were ill, you wouldn't have gone near them anyway. So we thought that's good. They've locked down. They've got plenty of PPE. They've got good staff. They know what to do, and the family were reasonably happy that the right action had been taken at that point.
Thank you. And were you able to call and get updates about your parents at that point?
It was quite difficult because, and I know a lot of others will have said this, we felt they were so busy, they were under-resourced, it was like all hands to the pump. You know, sometimes I'd phone up and the phone would just ring out and out and out and out. But to be honest, that happened before COVID as well. So the contact information is quite difficult, and if they quickly answered the phone, they say, well, how are Mum and Dad? How's Mum? She's fine. And that was more or less it. You didn't get any more information. But again, we didn't want to hound them and pull them away from people they might be caring for. So I stepped back a wee bit and just kind of let them get on with it at that point.
And did you know how your mum and dad were finding that initial lockdown?
Well, it was different. How would I know? Because they never gave us any information. And I only know because I know my mum. And I know she'll be asking, where's Alison? Where is she? Why isn't she coming to see me? What's happening? What's going on? I want to go home. You know, all of those kind of, I know she'd be saying that. And then when we tried to set up some Skype calls, and she didn't know what was going on. I mean, the technology when you're in your late 80s and you've got dementia just doesn't work. You know, that was a ludicrous, you know, decision to expect a lot of families who have relatives with dementia to actually be able to connect with their families like that. That was absolutely hopeless. Mum would get the screen, and if she could hear and see I was on it, she'd stroke my face on the screen. And then she'd say, where is she? Where is she? And she'd get distressed and start pacing around the room and saying, where is she? Why isn't she coming in? What's going on? Why are you on the television? You know, questions like that. And I could hear it through the Skype.
Did you find that quite distressing?
Really distressing. And I've actually recorded some of them. I look back and I just think, how on earth could anyone think that was an acceptable form of contact? Because it was more distressing than not doing it. The only thing I could actually see if she looked all right, and that was, but it was crumbs. It was getting crumbs of comfort. So, and telephone calls were the same, because with dementia, you need face-to-face, you need to hold hands, you need physical contact. So phone calls, especially when they're deaf as well, you know, that's just, everybody's shouting, you know, and that's not an acceptable form of contact either. So it was difficult.
Did you ever contemplate taking your mother out of the care home?
I did, and I discussed it with my brothers, and I thought, you know, Mum would benefit from being out. I'm not working at the moment because I've lost a lot of work through COVID. I could actually look after her, and I discussed it with my brothers. They thought it would be too much for me. But actually, more of us thought the one bit of comfort she is getting in the care home is that she's still with my dad. They were still together, and that was the overriding reason that I didn't take her out. They still, at that point, had a great connection with each other, and that was really important to them. So.
Thank you. And you've said that you couldn't have any video calls, or, well, you tried to have video calls and telephone calls, but they just wouldn't work. You say in paragraph 13 of your statement that the care home set up a WhatsApp group for residents and families to try to keep them updated. How did you find that?
Again, it was quite generic because there's 32 residents, so they obviously couldn't take photos of everybody all day, every day, and what they were doing. So it was basic at best, and I ended up getting sent pictures of other people's relatives, and I'm not that interested. Not that I didn't care, but I didn't want to see other people's relatives. I wanted to see Mum and Dad. I wanted to know what was happening with them and what they were doing. And it was mainly updates about, maybe what was happening with the guidance, or rather than anything hugely personal. So it was pretty useless.
Okay.
Latterly, in COVID, it was better because it was more tailored and there was less pressure on the staff.
So they continued that the whole way through,
and they still do actually. It was a good thing to do in the long term.
That's good. Thank you. Now, you had your first window visit on the 19th of March 2020.
Yep.
Could you tell us about that?
Yeah. Well, the way the care home is, it's an old building, and it's. You have to go around an alleyway that nobody walks down, and it's a window, and it was the only window that was the right level for residents to be able to sit on the other side, and for you to be on the other side to be able to see in. So they were sitting there with a member of staff.
Would they take it in turns to sit there? This wasn't in anyone's bedroom?
No, it was in a corridor.
Okay.
It was in a corridor where the window was. So the staff would bring them, and they'd sit them down in some chairs, and the staff member would stand there. And for the first window visit, the window was actually very slightly open.
Okay.
So I was able to slip my hand underneath, and Mum would hold my hand, but she'd pull it and try to pull me in. I said, Mum, I can't come in. I can't come in. Why can't you come in? I said, I can't come in. I just said, there's a bug going round, and I don't want to give you the bug. She said, oh, that doesn't matter. We'll shake it off. It's fine. I'd rather see you. I'd rather be with you. Come in, please come in. And then she would get distressed. And then my dad would get distressed because he could see her getting distressed. And again, she'd end up pawing the window and banging the window, say, come in, come in. Why can't you come in? She couldn't understand what was going on and why I couldn't get in. And then as window visits did progress, and restrictions became even more severe, they shut the window and they locked it so that you couldn't even have the contact with the hand. And nobody could open that window, and I was worried about it as a fire risk as well. I think that was the wrong, because windows are meant to be able to be opened, but there were nails in it, so that I couldn't pull the window open.
And did that affect your ability to communicate with your parents?
Completely. I think even the touch for me was really important, very important for Mum as well. I could feel her hand tightening on mine. I think she felt abandoned, and that was one way of connecting.
Thank you. And did it affect your mum being able to hear you at all?
Yeah. Well, she kept taking her hearing aids out, and the hearing aids got lost, and I would have to shout through the window, and if it was closed, so I'd have to bang to get her attention. And sometimes I'd take my son's girlfriend with me, and sometimes the dog, just to try and make it a better visit, so I could get a smile from them. But it was crumbs. It was crumbs of comfort, but the crumbs were.
But initially, you were able to take someone else with you to the window visits, and.
Well, occasionally,
well.
I was allowed, but occasionally, but no. Everybody in the family found it just far too torturous to go through that. So I ended up a lot of the time just being me and the dog.
Okay.
Just to try and get some reaction from them, just to see. But at the same time, I could still see them. I could still see their faces and their skin, to see that they were all right. Because relatives are also guardians, and inspectors. And when we go in to see our families, we check them. We check that there's no bruises. We check all sorts of things. We check that their nails are not too long, and I even used to take Mum's socks off to see if her feet were all right, because feet in the elderly is absolutely critical. To see that the nails weren't rubbing into the other toes and making them bleed, and because that's happened before. And I couldn't do any of that, and I worried about all of that.
You see that as being central to the role of families. I think you used the term policing in your statement to describe that, and you couldn't do that.
Couldn't do any of that. I could see just if they, but what can you tell just by seeing somebody's face when they look really unhappy? You know, and Mum was always getting UTIs. There was always something, you know.
Did you feel guilty because you weren't able to do that?
I didn't feel guilty because it wasn't my fault.
No, of course.
But I felt very angry. I felt they weren't being looked after properly. And I did, and we'll probably go into this, but I didn't feel valued as a member of the care team, which I was.
Yeah. Now, you told us that initially you were happy with the restrictions. Your family believed that that was the right action to take. Did there come a point where your views changed?
Yeah, that was round about the summer of 2020. And we were there for an outdoor visit in the garden, and the care home had actually brought in an entertainer, a singer, which was great, and it was a lovely day, and everybody was outside, and they phoned us and said, you can come, you and one other can come, and but you'll have to stand behind the fence and just watch. But we thought, brilliant, you just accept any little crumb of any kind of contact. And so we did that. And the entertainer was great. But Mum saw me and she started to come towards me. And of course, they pulled her away. And that was really, really distressing. And you know what it felt like? It felt like I was going to the zoo and watching animals on display in the zoo. Don't touch, don't go near them, don't go near them. These were my parents. I mean, looking back, I was angry at the time, and I'm still angry that happened. And my dad knew I was there, and he waved, but he was a bit more passive in his dementia, whereas Mum was still relatively on the ball, and she knew what she did, but she couldn't understand why she couldn't come near me. And eventually, she just went inside. And that was the end of the.
Were you all wearing masks outside?
No, and the rest of the society at that point weren't wearing masks either. And because we were so far away, we weren't. So she could actually see my face, and at that point she could see me smile. And I had to yell, "Mum, it's all right. It's all right. Soon we'll be in. Soon we'll see you soon. I promise. I promise." I kept telling her that to try and keep her going. But.
And in paragraph 16, you say that you started being concerned about the effects of COVID, the pandemic restrictions and masks on people with dementia at that point, and you raised concerns with both the care home and the care inspectorate. You also raised issues with not being able to see your parents properly.
I wrote to everybody that was. I've hundreds of emails, hundreds of postings. I really that summer incident really kind of propelled me into action. I thought I need to do something here. And the other thing that I just missed was I had a friend whose dad was in a care home in France, and she said, what's going on in Scotland? What are you doing to all the? She said, we stood outside the care homes and we protested that we needed to be with our loved ones who had, especially ones that had Alzheimer's, because the impact of not being with them would be a lot worse than COVID. She said, and our health minister listened to us, and he reversed the decision, and we were allowed in from May 2020, and that was without masks and without vaccinations. And I've checked the stats, and the death rate was no different from the UK. So I just think, why weren't we doing that? And that precipitated me into the campaign and action and trying to challenge everything that I possibly could. So those were the two things, and that included the masks as well.
And were you referring to the French example when you were contacted?
Yes, in all my letters to Jean Freeman, to Kevin Stewart, to the Care Inspectorate, to the Mental Health and Welfare Commission, to basically anyone that I felt was in that decision-making position. The evidence was there, and nobody looked at it. You know, all throughout all my correspondence with all of these people, I sent in
and
research
organisations that are to represent people with dementia. And
I don't even know if they listened and they probably read it, but I got copy and paste letters back.
Okay. What were the responses?
Just that we're managing, you know, something that we've never managed before, and this is this public health, and it was all the kind of cop-out lines. We're just trying to keep everybody safe. All of that.
You said a moment or two ago that in May 2020 you heard about the French, or you were informed about the French experience, and you then said you've checked the statistics and the death rate was no better, no worse than it was in Scotland. Did you do that contemporaneously in May, the current figures in May 2020, or is that something you've done subsequently?
It wasn't. It was in July, because it was
July,
after. But it was my friend that told me from May 2020 they were allowed into the care homes.
I beg your pardon.
And then I kind of checked. I said, well, what are the numbers like in France? It was more anecdotal.
Yeah, I understand that, but you checked contemporaneously with taking that information?
At that time, in that summer of 2020.
And you said that when you wrote to the various bodies, and I see who they are in paragraph 18, you provided information. Did that make reference to the French figures?
Yeah, not. Again, it was anecdotal. I said I don't know numbers, but I know the numbers are not as great as you might think. I was trying to obviously make the point that keeping people out doesn't necessarily, keeping family out doesn't necessarily mean you are saving people from COVID. You know?
Were you trying? Apologies, landlord. Were you trying to alert them to the existence of an alternative approach in the hope that they would look at this? Well,
why wouldn't you look at good practice somewhere else? Why wouldn't you look at the not success story, but why wouldn't you see that actually, you know, look, you've got evidence here. Look at it. Please just look at it and maybe reconsider. I said, you keep telling us you'll let us in. You let us in after we've been vaccinated. You let us in after they've been vaccinated. You let us in after the second vaccination, or the third vaccination. You let us in. And they kept dangling us all along, and it was absolute torture, lurching from one decision to the next. And I thought, if they've got evidence here of good practice somewhere else, and they value these elderly people in care homes, surely they must look at it. I can't get my head around the fact that they didn't.
They didn't. There was nothing in any of the responses to you to suggest that they'd looked, but there was a reason not to follow that.
No.
Thank you. You say that you considered it unfair that people could visit elderly relatives who lived at home but not in care homes, and you raised those concerns with all the organisations too, and there was still nothing.
The discrimination was blatant for me, and a real human rights abuse.
You say in paragraph 19 that you felt the Scottish Government didn't listen to the science on the issues. Could you expand on what you're referring to by the science there? What was it that they were?
I've got quite a lot of people that work in the in medical side of things, and you know they kept sending me things about particularly about mask wearing. You know, mask wearing for me, unless you wear them properly in specific circumstances as well. A lot of the staff weren't even wearing the masks properly, but it was more, the mask wearing was more because of communication issues. You know, my mum was deaf. You know, and also if you're surrounded by a group of people 24/7 wearing masks, and you don't see people smile for up to 2 years, what kind of effect is that going to have on your mental health and well-being? And they're wearing masks. Some care homes are still wearing masks. So, you know, it was that aspect of it, and you know, various contacts in social work that sent me links about the impact of mask wearing, in particular. And I get that, you know, at the start they didn't understand how the virus spread, and I got all that. But as time went on, you know, we never seemed to hear about the other research, about the other evidence that was out there. It was only just the one track, and we're trying to keep your parents safe. Always trying to keep your parents safe. And I think that didn't matter if they died from anything else, as long as they didn't get COVID. That was the whole reason for everybody, you know, working in a care home at that time.
And then you go on to say that from the 4th of July 2020, you were able to have outdoor visits. Where did those take place and what was the setup?
Again, that was everybody in every resident care home appears to be cold all the time, so they would wheel my dad out in the wheelchair, and it was like the length of a table tennis table, and I'd be at one end and mum and dad would be at the other, and there was a clear screen in the middle, you know, high enough, and the staff from the care home would come out and stand and watch.
So you didn't have privacy?
No privacy, and I had a mask on at that point. And of course, Mum saw me, and first thing she wanted to do is she would get up and she'd come towards me, and she'd be pulled back again. And that was, and again, distress caused for her, and also distress for me. It was absolutely awful. So again, yeah, what is meaningful contact? That certainly was not meaningful contact. It was awful. The only thing I could see is that she was still moving, she was still mobile, and I could see her face. So, you know, that was the crumbs I got from those visits, but they were tough as well.
And then after that, it reverted to window visits again, which you've already told us were not beneficial for you or your parents.
And the weather got colder for us outside, and invariably it'd be raining, and the pouring rain would be standing outside. So it was difficult for family, you know, in the winter.
Yes. Were your parents allowed to see each other at this point?
Yes, yeah.
That continued in that.
Yeah, most of the time they seemed to be together, sitting together, holding hands. So that was the consolation the family had, that they were together and they weren't alone in that sense.
And did the care home keep you updated of the guidance, or is that something you had to find out for yourself?
No, I found out mainly through the care home relatives or from my own contacts.
Not through the care home?
No, sometimes I'd know before them. And I would say, well, this is happening. Well, we haven't had it through yet. We don't know yet. We can't do anything. We can't allow that until we hear officially from Public Health.
Was that quite frustrating?
Very frustrating, because we knew what was coming. You know, when you're 89 and 90, you know, time is not on your side. Every day could be your last day. You know, you cannot say, oh, this time next year we'll let you in. Well, Mum and Dad might not be here next year. Every moment counts for those in that. Every second counts. You never know when that call's going to come. So, you know, that was the frustrating aspect. And then you're thinking, I haven't actually touched my mum and dad. You know, is that the last time I'm ever going to touch them before they die? You know, those thoughts go through your head all the time. It's tough.
And you say that in November 2020 you were able to have visits in the care home conservatory.
Yeah.
How were they set up? Were they more effective?
That was just as there was in the conservatory. They also had a plastic screen between us again, so it was the same. It was the same situation. And then they had the conservatory door open, and as long as you were 2 meters behind, and you know, Mum and Dad would sit. Again, it was like visiting the zoo. And Mum would try and stretch out, and there'd be somebody hovering, watching, and you know, just keeping an eye that we didn't actually make physical contact.
Were you standing outside the
Yes.
conservatory?
Yeah.
Okay, and your parents were inside.
Yeah, but the door was open, but there was a barricade. There was a barricade, so I didn't step over that line of do not return, do not pass go.
Yeah. And of course, you've said many times the masks were. Created difficulty. Did you or the care home give any thought to clear masks? Did the care home at all talk about providing clear masks or visors so that...
They didn't, but in one of the emails back from Kevin Stewart, he did say, when I was challenging about the mask wearing, he said, well, and the communication, the fact that Mum couldn't see because she did some lip reading, he said, well, we are beginning to get the clear masks and we'll get them sent out to the care homes. That never happened.
Never happened. Okay. Now, in paragraph 25, you say that in January 2021, at 9 p.m, you received a call from the care home. They asked you to...
It was 9 a.m. It was in the morning.
Oh, okay, 9 a.m.
Yeah.
Thank you. And they said they asked you to go over because your father wasn't responding. Is that right?
Yeah.
What were you thinking at that point?
Well, as I said earlier, you're always on tenterhooks with that call. And my dad was 80, was he just 89? So you always think at some point you're going to get that call. And I thought and the care home never make that call to you unless they think it's, especially during COVID. There's no way they would have phoned me if they didn't think this was perhaps the moment he was going to die. Yeah. So I got, and of course I was the only one that was allowed. So I didn't have anybody with me. So
even though it was the end, they thought that it was end of his life, they didn't allow the rest of your family to join you?
No. And I phoned my brother on the way over to prepare him. He said, well, just keep me posted. So I got to the care home and I got suited and booted up, and the member of staff took me to my dad's room. And as soon as I got into the room, I took everything off, and they stepped out and they gave me the respect of being alone with him. And he looked terrible, and I thought, gosh, because I'd never seen anybody die before, and I thought, is this what it looks like? It was just all new to me, and he was unmoving. He was grey, his eyes were glazed over, his skin just looked awful, and I thought, oh gosh. So I started to talk to him. I started to shout, Dad, it's me. Dad, it's me. It's Alison. It's Alison. And I thought, and I put my hand under the cover and I held his hand and I said, Dad, if you know me, squeeze my hand. And he squeezed my hand. And after that, I said, oh, Dad, come on, don't you leave now. Don't you leave now. And then I saw his tongue come out licking his lips. So I said, do you want a drink? So I got him a cup and I just got him to sip the drink, and his tongue came out and he brightened up and he smiled. And after that, he's not great at communicating because he's quite advanced with his dementia, but I knew he was engaging with me. And after that, he rallied, and he's still here today. And I am convinced that had I not gone in that day as a valued member, as his daughter, he would not be here. And I tell this story to illustrate the importance and the value of family, because he was very frail, but he clearly still wanted to live if family were around him. And it made all the difference that I was there. I couldn't actually believe it. I couldn't believe it that he came round. It was like rising from the ashes. So, and it was a great feeling.
Thank you. When you said that your family weren't allowed, you were the only one. Did that include your mum? Was she offered the option of being by your father's bedside at that point? I
don't know if they brought Mum in, I don't know. I think I was just so consumed with him. I didn't even think of Mum at that point. I mean, we tried to, our dementia it's still new, but I'm not sure how much, it's difficult to gauge how much she would have understood about what was going on. But she always asked, where is he? Where is he? But then she was so forgetful that, sometimes she would forget latterly that, is that my husband over there? And there'd be somebody else, another man in the care home, and we say, no, that's not Dad. Dad's over there. So that's the kind of condition of dementia. So it'd be hard to gauge. But I'm sure she would have felt it definitely.
And did that strengthen your resolve to contact people and try to fight for access to? They are not just people to be dispensed with. They are important, and family are important. And care for me means kindness. There's very little kindness of any kind shown to families. And that there was no compassion. The compassion disappeared. You go on to mention that your dad turned 90 on the 22nd of January 2021. And you were allowed to visit him that day, but you were the only one.
I was the only one,
and your mum was quite distressed that day. Was there a particular reason for that, or?
She was just very agitated, and just I think there's a lot of confusion when you've got dementia, and she wouldn't sit down, and she kept saying, I want to leave. And I said, don't leave, Mum, it's Dad's birthday. It's quite difficult celebrating your dad's 90th birthday on your own, and no other family allowed. But I'd pushed for essential care status at that point. So that's why I think I was allowed in. And it was good to be with him. And then actually, I had to go, and I can't remember whether it was actually the day of his birthday or before, because he got a cake at a different time. And I wasn't allowed to go to that celebration with other residents. I wasn't allowed to go into the care home for that. I was just allowed to see him, to say happy birthday, and that was it.
Okay, thank you. Now, at some point, visits were allowed inside again. How many people could visit at that point?
That was when Mum and Dad were the visits in their own room, and we would go in through the emergency exit, which was quite near to their bedroom, so we didn't have footfall through the home, so we weren't traipsing through the home, and literally somebody would let us in and guide us to the room, and generally it was only me. And I think at the start it only had to me. I think it was only one visitor.
Did
can't
you
remember
go
how
with
long
your
it-
brother and switch?
Yeah, and then that was just before that, before the room visits actually. That was following on from the visit inside with the screen. Then there was kind of an interim period where if two of us wanted to visit, we couldn't see Mum and Dad together. So my younger brother would visit my dad and I'd visit my mum, but we were travelling in the same car.
What were your thoughts on that sort of artificial separation at that point?
It was just, we couldn't be together. They wouldn't allow us to be together as a family. You know, we'd been tested and vaccinated. We were, at that point, we were still wearing masks.
And you'd been with your brother in the car, sharing a space.
Yes.
But you weren't allowed to be in the same space in the care home.
So that was like that period, and then there was a period in the room where Mum and Dad were together, and I could go in, but my younger brother didn't come at that point, so I'm not sure whether he would even have been allowed in at that point. It's funny, I could see them together, but the four of us couldn't be together. And I thought, where is the science in this? Where's the logic? Where's the rationale here?
In paragraph 28, you go on to say that in March 2021, you were able to take your mother out on day trips, but you both had to wear masks for that to happen. Were you happy with that condition?
No, but once I got her out, I took the masks off. So it was just a matter of getting her out at that point. But I was still quite concerned about 20 minutes in the car, and then I could see her coming round again. I could see a bit of the old mum coming back. And then by the end of the visit, visit's the wrong word, by the end of whatever we were doing, I could see her getting anxious because she was going back in again into prison. And I could see her body deflate. So those were quite, once we were out, it was great, but taking her back was really hard. We just wanted to run away together, but then we couldn't leave Dad. So, and whenever she said something like that, I said, but you can't leave Dad. She said, no, how are we going to take him with us? I said, well, it's difficult, but this won't go on for too much longer. Mum will all be back together again. I kept saying that to her all the way through to keep her going, to keep her, so she didn't give up. And then that escalated because obviously I stopped wearing a mask, and they wouldn't let her come out unless they wouldn't let me pick her up to take her out unless I was wearing a mask.
And you told them that the guidance had an exception for on the basis of communication needs.
Yes.
Is that correct?
Yes.
Did they accept that?
No, that was a very difficult day, and that's a day I will not forget in a long time because. I said I have an exemption for communication. I didn't even need to explain that. But they said, no, you have to wear a mask if you're taking your mum out. I said, no, I don't. I said, and I don't even have to argue about this. I said, it's my right not to wear a mask. I have an exemption. Then they got somebody else in, more senior, to talk to me about it, and I got a whole list of people, well, such and such is wearing a mask. Nobody else is doing what you're doing, and you know, I said, but Mum needs to see me smile, and Mum needs to hear me speak. She needs to see my lips move. I've been vaccinated. I've been tested. I said, I will not put my mum in any danger and take her out. And they brought somebody even higher up. Said, no, we're going to phone public health. I said, well, I think you'll find that I'm right. I said, I want to take my mum out now. No, you can't take her out now. So then I got really upset and I started to cry. I said, why are you doing this? Why are you separating me from my mum? Why are you being so difficult about all of this? I challenged absolutely everything. Mum was getting distressed. Eventually they took her away. They pulled her away from me. And I left the care home sobbing and crying because I felt abused. I felt bullied and I felt abused on that day. And there's that saying, isn't there? You can never forget what people did or what they said, but you will never forget about the way they made you feel. And the way I felt that day, I thought, everything about this is wrong. Everything about this is wrong. And I felt I had very little support anywhere apart from the care home relatives group. It was the only way I could kind of vent some of my anger because nobody else seemed to listen.
Yeah.
Also, on the basis that if you'd put your mask on, taken your mother out, taken her off the minute you're in the car, and you could have spent the rest of the day with her.
And the care home never had COVID.
Yeah.
You know, they were, you know, we were doing all the right things, you know, and it wasn't dangerous.
I mean, plainly, you wouldn't have done anything to harm your mother, and therefore, if you had been in any doubts about the propriety of not wearing a mask, or the danger, for example, if you had any doubts about the fact you may have had COVID or anything like that, or even another infection, you wouldn't have done it, I've no doubt. But if you were satisfied that you were correct, and you had no reason to suspect there was anything that you could communicate infection-wise to your mother, as I say, go in the car, take your masks off.
Yeah, and it was the inconsistencies all the way through.
Illogicality.
All of that, just really, and I know you'll probably go into it, but the testing side of it, you know, I'd go in, get my test with the designated person and sit and wait for 20 minutes for it to be clear, which it always was. And I watched in the other room as staff were tested, didn't even wait for the outcome of the test and went straight into work. And they're pulling me away from my mum. They were endangering my mum much more than I was. And I think it was the unfairness of all that, the illogicality, the science, everything about it was wrong. And I just felt like I was fighting this battle and nobody was listening. Yeah. Did they not see it for what it actually was? That was hard to get your head round. I think we all felt that as a relatives group.
And you say that you were effectively banned from the care home at that point.
Yeah.
And the following weekend, you actually had to take your youngest son to what felt you sneak your mum out of the care home.
Escape from the care home. Take two. I thought, I'm going to get mum out. She needs to get out. So I asked my younger son, I said, would you come with me? Would you go in and get your gran?
You parked round the corner?
I parked round the corner because I was persona non grata at that point. And I bring her out. And he didn't object quite so much to the mask wearing. He says, I'll just use it I'll just wear it to get gran out. And it was at weekends as well. And they weren't as stringent, they weren't as strict at weekends. It was often different staff, and they weren't as strict. And he got in, and I saw them. I remember the moment when I saw them walking round the corner, and they appeared on the horizon, and he'd got her out. And we got her into the car, and we went away to the park, and we had a coffee, and we had a walk about, and it was a really lovely afternoon. And then, of course, we had to get her back. You know, we had to sneak her back in, and she didn't want to go back. But he put the mask back on, and he dropped her off, and then he came back. And obviously I was hiding in the car around the corner so nobody would see me. And that was a small sense of achievement that I actually managed to get mum out and give her some proper family value time. But it's tried to break your mum out of the care home. I mean, really? Really was.
And subsequent to that, you were actually contacted by the care home, and they apologised and said public health had confirmed that you were right.
Yeah. That I had an exemption, and that was my right not to wear a mask. But I think they were getting grief from other relatives if anybody around was not. But I wasn't in contact with any other, residents, so I don't know why that was an issue.
Yeah. But after that, they allowed you to take your mother
Yeah.
without a mask?
Yes. Yeah.
And did that make a big difference?
Although they did, but I still had to say it to a lot of the staff, because they would still
Okay.
say to me, you don't have a mask on. I said, yes, I don't have a mask on, I've got an exemption. So I don't know if the message got all the way around.
So every time you had to
Yeah.
repeat
Yeah.
this? Okay. Then you go on in your statement to say that in July 2021, in paragraphs 33 and 34, that your brother returned home from Thailand, but he unfortunately had cancer.
Yeah.
Did he attempt to visit your parents?
He was guided by me on a lot of it, and he was very, very close to our parents. And I, because he lived abroad, I think I did a lot of the caring I did was to really help him connect, you know, so we'd do video calls pre-COVID, we'd do all sorts to try and, so that he still felt part of the family and the relationship with Mum and Dad. But he was really very weak when he came back that July, and I think he potentially knew that he might not have all that long, and he was keen to see Mum and Dad before something happened, or indeed before something happened to them, because he hadn't seen them for 18 months. So we tried, but it was just he couldn't walk very well. He needed to be accompanied because he was quite, and he also he was a bit concerned about infection because he'd had 40 odd chemotherapies, so he was worried about infection. I said care homes are probably the safest place you could go, and I said you're probably the safest person to go in as well. But there were all these other factors put in his way. He wasn't allowed to be accompanied, and he couldn't go in on his own. So I just felt they made life and the possibility of a visit too difficult for him, and he never saw them, and they never saw him before he died.
So even though, were they aware of the circumstances, your brother's circumstances?
The care home?
Yes.
Oh, yes, because when he was diagnosed, he stayed in Scotland for treatment for quite a while. So he would always come to the care home with me pre-COVID.
Okay.
So they knew him, and they absolutely knew the situation with my brother.
But they weren't willing to make any exceptions to allow someone with him?
No.
Okay. And unfortunately, you say he died without having seen your parents.
Yeah.
And you decided not to tell your parents at that point, owing to their dementia.
Yeah, Dad.
Right?
I don't think Dad would have got it. Mum would have got too distressed and would have forgotten. Then we'd have to tell her again. So even to this day, we still for Mum and Dad, we still pretend he's still alive if they mention his name, just to give them comfort. But it's quite hard for the family to do that.
You mention, you say at paragraph 35 that on the 15th of October 2021, you had your first normal visit. What do you mean by first normal inside visit? What do you mean by that?
I still had, it wasn't normal because I still had to wear a mask. I still put a mask on to enter the room, I think. But as soon as I got into the room, I took it off. I suppose it was normal in the sense that I could have taken somebody else with me. I was able to chat with them, but I still wasn't allowed to take them out of the room. So it wasn't really normal. Again, there's a bit of progress, but it's, when was that? October 2021. That's a year and 18 months later. So again, it's still nowhere near normal, but it was better. And, and the families, we all felt we are finally making some progress here. But I think we all viewed the fact that the rest of society seemed to be completely opening up, and there was still all these restrictions. There was still, there was still the testing, everything. So it wasn't really normal, but it was better.
Thank you. And in January 2021, a few months later, your mum contracted COVID.
2022.
Sorry, yes, 2022. Your mum contracted COVID. And was isolated for 10 days.
Yep.
Do you know if the staff provided her with any activities and stimulation during those 10 days?
How do I know?
They weren't telling you that
no.
They were doing anything.
No, and I mean, I know how busy they are, and I think I'm just trying. I was going back to that time, just trying to imagine Mum sitting in that room, all by herself, with only one kind of staff allowed to go in and see her in the full white suit, the booties covered up, the mask, everything. So she couldn't see a face, she couldn't hear. She's in this fog of dementia anyway. You know, she's sitting in a chair for 10 days on her own. I just, all of that, I can't get my head. And she had no symptoms, she had no actual, she wasn't ill from COVID. She just had she just tested positive. And also being separated from my dad for the first time in a long time. I just thought that is a terrible, terrible thing to do to an individual, especially at that age. I got in to visit her, but I had to wear the full suit as well. And she just, you know, and after that, I think that was the week that broke her spirit. I think that was the week that I kept telling her, don't give up. I think that was when she kind of gave up and almost accepted her fate. And I felt it. I felt it.
You say in your statement you were able to see her once during that time,
Yes.
is that correct?
Yes.
Did she appear that? Is that what you're basing your description on?
Yeah. But also post it when I saw her start to moving again. She was very stooped.
Okay.
The kind of, the day she came out, I went the day after she came out of isolation, and she was very stooped, and she didn't have the strength to kind of move her legs, and her cognitive ability was, I mean, that came back a wee bit once she was in the real world again, but the real world, whatever that is when you've got dementia. But she significantly deteriorated during that phase, and that was far too long to be isolating somebody of that age and with a cognitive disability.
Do you think that decline could have been prevented?
Yes, with a shorter isolation, yes.
Okay.
Yeah. And I think there are other ways of doing it. They can still, you know, I think it depends what the care home's like. You know, there were other ways of, maybe some other people could have gone in. Maybe there was definitely a better way of managing that, but it starts with the length of time of isolation, and that should have been, and it did latterly go down to 5 days, I think, after that. But she missed that. She was in for 10.
When you say there could be other ways of managing that with other people going in, do you mean people going in to spend time with her, provide her with activities, that kind of thing?
But I think there was obviously staffing issues there. But then I could have done that. I could have gone in every day to help her, but they wouldn't let me.
Yeah.
I was available. I wanted to. I even applied to be a volunteer in the care home.
Okay.
So that I could see Mum and Dad and help out. And that was rejected for confidentiality issues. They wouldn't allow that either. Honestly, the care home was ruled with an iron fist. It was an iron fist. No family. And I think they became more and more entrenched as time went on. It was like us against them in my care home. That's what I felt.
Yeah. Thank you. Now, moving on to the issue of DNA CPRs, you say that your father had a notice in place prior to the start of the pandemic, but your mother didn't have a DNA CPR notice. You say in paragraph 40 of your statement that you received on 20th of March 2020, very early on, a phone call from your mum's GP, and then a letter stating that a DNA CPR notice had been placed on your mum's file. After receiving the letter, you telephoned her GP. Could you tell us about that conversation?
Yeah, and I also have the letter here as evidence as well, where they talk about my relative. They don't even mention my mum's name. You know, she was just another statistic, another figure, another old person that was collateral damage. And I challenged the GP. I said, you cannot enforce this on my mum without a proper assessment. I said, I might have agreed to this, but you cannot run it past, you cannot just enforce it without seeing what she's like. You barely know her, you don't know the condition she's in. You know, I said, and is it my mum you're talking about? Because you've said it's a relative. So I challenged all that, and he said, no, this is, basically he said, I've got a quote in my diary as well. We can't risk using an ambulance for your mum. That was basically
what he said to you. Did he explain to you that a DNA CPR notice should only relate to cardiac arrest and CPR, the administration of CPR, rather than other treatments?
No, he didn't clarify that at all.
He told you that you couldn't not just in the situation of cardiac arrest, but in any situation, call an ambulance for your mum. If she needed any other treatment, that wasn't going to be provided.
No.
And that's because of the DNA CPR notice.
Yeah. That was the maybe I was a bit worked up about it. I can't honestly remember. I was just so appalled that somebody could actually issue this kind of notice without assessing somebody.
Yeah.
You know, that was my main gripe with that, because she did go to hospital when she had a fall.
Yes.
So, but she was sent to hospital on her own in an ambulance with nobody with her, and I wasn't allowed to go. So that was another. And to be honest, I didn't want anyone to go to hospital, because hospitals were generally hotbeds of COVID anyway. So, so there was some slight issues connected to that. But I was so appalled with this notice that I got, and I thought, everything, I've got power of attorney, everything about that is wrong.
Yeah. So, and despite challenging the GP, he or she refused to come out to the care home.
Yeah.
But the notice remained. Okay, they told you that they couldn't. That GPs weren't allowed to visit care homes.
Yeah.
Okay, thank you. Now, you go on to talk about PPE and testing.
Yep.
You mentioned that the care home provided relatives with tests, but that the procedure for relatives and staff was quite different.
Yeah.
And you found that both frustrating and concerning, is that right?
Unfair. And wrong, and actually endangering mum and dad a lot more than I was. And I even talked to the chap that was doing the tests. I said, "What is that? They're not waiting. They're not waiting for the outcome of the test." And he just went.
What did they do if they'd gone into the care home and the result turned out to be positive? Did all the carers have to self-isolate at that point, or was it just the...
I don't know, but I know care workers were off at various times. I think they tested positive, they didn't come in, or... but I genuinely saw that happening on 2 occasions, and I said to the guy doing the tests, I know his name, but I won't mention it, what are they doing? I said, they don't know whether they're negative. He says, oh, but they're needed in there, they need to get in there, need to get to work.
Yeah. I mean, you say that if they tested positive, they wouldn't come in, but if they're already in the care home with all the other staff on duty that day, well, they could potentially infect everyone, and then and also there would be no staff.
A lot of the staff have children and were going to supermarkets. I live on my own. I was much less of a risk than, you know, they kind of follow on from that. If you're following the logical scientific pattern, it was ridiculous. It really was. But I think it was all to do with resources. I don't think there was anything malicious about it at all. I think they just needed to get in and get to work and help. And I think that was the main reason they were kind of under-resourced, as a lot of the care homes are anyway. So.
Yeah. Thank you. And you say that in terms of PPE, though, they were quite well resourced for that. The stocks of PPE were good, and you say that they were used appropriately, or?
Well, yeah, you see, you know, them here, you know.
So they wore them under their mask.
Yeah, and I felt for the staff, because they were wearing them all day.
Under their nose, sorry.
Every day. I mean, and care homes are the hottest of places. You know, they're like tropical buildings, and you know, wearing those masks all day, every day must have been really hard for them. And they all, you know, the staff all look so tired all the time. I really felt for them as well. But they were all terrified as well, and I think the underlying everything was fear.
Yeah.
Everything they did was because of fear, and they were terrified that they were going to be the one. But on the same matter, if you're taking a test and not waiting for the outcome, you know, that's a decision you're making that might end up causing COVID. So again, so many inconsistencies, so many kind of, it just doesn't add up.
Yeah, thank you. You then go on to talk about the impact on your mum. Can you tell us the difference before the pandemic started and after the pandemic? How she was?
Yeah, well, she still knew who I was, probably up until I would say maybe, know me by name, where she'd say my name, probably up until the summer of 2020. Okay. And after that, I think, even though I was trying as much as I could to do the window visits, to do the garden visits, to even try the Skype so she could see my face, mentally I could see her losing the ability to articulate as well, not speaking as much. I think that was a lot to do with the mask wearing, because she couldn't lip read, so her speech began to decline. I could see from her mobility, from what I could see from a distance, I could see that declining. She was becoming, particularly after the episode when she was confined to her room, when she got COVID, I could see that probably had the most significant impact in terms of her overall health, and she's just basically declined mobility, mental ability. She used to be able to hold a cup really strongly before COVID, and now it's I get that it's a progressive condition. I get that, and because we watched it with my dad, I understand all that, but it was definitely speeded up because of all the things that happened and the lack of being with family and the interaction and the social isolation had a huge impact on her speech, on her mobility, on her spirit, on her physical. Do you know her teeth? She lost more teeth during COVID than she did, the 5 years before that. Were her teeth being brushed? Our eyesight was failing. We couldn't get an optician in. Yeah. There were all these other things about her physical things that can make a life in a care home just that bit more comfortable and easier. They were all pulled away from her. Yeah. And that had a detrimental effect on her overall health and well-being.
Thank you. And you mentioned before her feet and toenails. Yeah. Were podiatrists allowed into the care home?
No.
What do you think the consequences of that were for people in care homes and their ability to walk and get around?
Yeah, catastrophic. I mean, and I saw it because, when you visit a care home regularly, you get to know a lot of the other residents as well, and you chat to them, especially if you've got the dog, and they love the dog. So I got to know a lot of faces. Pre-COVID, I would say maybe 70% of them were still walking. I go in now, it's maybe 30%.
And do you think a podiatrist could have made a difference?
I think podiatrists, I just think, getting them up and walking them about, taking them outside, making sure they're always moving. Don't just let them sit in a chair all the time. I think all of those things, but it would generally be family that would also get them up and take them out and keep the mobility going. We were part of that, and that was taken away from them as well. So, it's quite a sad, sorry place to visit now. And I feel for the staff as well, because I think they feel it too. I think they feel worn out with it all, completely worn out. So I can see it, and if they're feeling down, it's going to transfer to the residents as well. So it's not a great place to be. But I keep trying. I will keep trying.
Could you tell us the difference in your dad from before and after the pandemic?
He was. Dad's difficult because he goes through waves, and he had quite advanced vascular dementia before the pandemic. So he was he couldn't speak. He would make lots of noises, but if you chat about things and tell stories and put his headphones on with his music, he would come to life. Yeah. I think he was more impacted by just being surrounded with people with masks, because my dad's a smiler. He's a great smiler. And if you can get him to smile, he will start communicating. But he didn't see anybody smile at him because everybody was wearing masks. And I do think that impacted on his quality of day-to-day life. They couldn't take him out. They used to go to the football museum. They used to go to visit other museums. Didn't get any of that. And I think at that age, at 90, you need to be doing things like that. And that was all taken away from him. Some of it's beginning to come back now. But I think he got a huge amount of comfort just from being with my mum and sitting in the same room as her and being with her. And to this day, he still sits and looks at her. And that's, out of all of this, that's probably the most significant thing in terms of us as a family trying to get some consolation from a dreadful traumatic experience, that they still had that connection together. And they were, hearing other family stories, at least we have that as a family.
Yeah. And in terms of impact on you, do you feel that you've lost time with your parents beyond the duration of the pandemic?
Yeah. I now if I want to take Mum out, I can't do it on my own. I have to take a friend with me, whereas before she could get in and out of the car. So I have to rely on somebody else to come with me, another family member. So that's changed, and that should would maybe have got another couple of years out of Mum, where we could have had that good family relationship. And she didn't meet her great grandchild for 9 months, and now she loves the wee one, and at least she's getting to see her now. But her ability, the wee one gets frightened of her because my mum will make random noises and be a little bit unpredictable, and I don't think she would have been in that state had the pandemic and the restrictions not happened. She might have got into it 2 years down the line, but it's that, I go back to where I started, that window of opportunity with dementia is so narrow. Yeah. And we learned that from my dad. And when the pandemic kicked in, I thought, oh no, this is going to finish Mum off, because she can't cope with being without family. Yeah. And she's still physically, I suppose, for her age, really good, but mentally, she's destroyed with it.
You then go on at paragraph 53 to speak about your late brother's time in a hospice.
Yep.
You say that his last days were badly managed and felt like being in a prison.
Yep.
That's right. And you say that despite being at the end of his life, he was only allowed to be visited by 2 named people.
Yep.
And that meant that at one point your sons pretended to be each other so that they could both see him, and the rest of your family didn't have a chance to say goodbye. No. Your brother,
from outside they did.
From outside a window.
Yeah.
Now you say that your brother, your brother's faith was important to him.
Yes.
But he wasn't able to take any solace from that.
Yeah. Yeah, he was too. We eventually got the minister in, but we had to turn cartwheels and speak to all sorts of people to make that happen, and eventually we got him in. But by that time, my brother was too far down the line to really. Maybe he did, because he held his hand through a glove, but I don't think he got anything from it at that stage. And if it had been 2 days, and even a day earlier, and again that was all procedure and process, and
So that's why the minister wasn't able to attend earlier. The procedures. Yeah. What did they need him to do, or what did they need you to do?
It was more because of the number of people.
Right.
And he wasn't one of the named people. So we had to add him to the list of named people, and that meant somebody else couldn't go in. And it was all that, and it was a terribly traumatic time. And I think one of the worst aspects was that we weren't even allowed to stay in the hospice overnight. So we could have lost my brother during the night and not been there.
And you say that usually does happen. Relatives are allowed to stay in the hospice.
Yeah, and that's part of being, hospice is normally a sanctuary, and it's normally about the whole experience for the whole family. Yeah. And he just wasn't given that dignity and support, and neither with the family, because of all the tests. There was testing going on.
They were still testing him every day for COVID.
And he was dying. He was dying.
Yeah, and you were still required to wear PPE around him.
Yeah,
again,
and every time we went out to the toilet, for example, we had to change and put another set of PPE on. And it wasn't just, it was the full suit, it was the boots, it was everything. And actually, we went out to speak to the nurse, and we were busy putting all our gear, all the PPE back on again, and we missed him dying because we were putting on new suits. So, these seemed like small things, but at that stage, they're really important. Yeah. And it was a very traumatic time, and it was made even more traumatic, if that were possible, by the restrictions that were put on hospices. I don't blame the hospice particularly, because they'd had fights with government about even getting people in to, family in at all. So I don't blame them at all. It was just, but it needn't have been like that at
So
all.
your understanding, this was down to government
Yes.
guidance, it wasn't policy
Yes.
set by the
Yes.
hospices? And even the having to change PPE every time you went in or out the room,
Yep.
that meant you missed your brother dying, that
Yes.
was down to government policy?
Yeah, the one element that I don't think is my brother, because my brother lived abroad, he'd been in the country for 6 weeks at that point, so, but they wanted to test for some other infectious disease, and they tested him every day with that as well. So he was prodded and annoyed for a full 10 days, well, 9 or 10 days in the hospice, and he should have just been left alone and to be comfortable. With family around him, holding his hands without all the scary stuff on. It was just awful.
And you say that you were told that you'd be given time to gather his belongings,
Yeah.
but that didn't happen, and you were handed his belongings in a black bin bag.
Yes, yeah.
And
That was just like the final insult. It was like, because we discussed with the nurse on the evening that he died, and they said, look, you don't need to do anything tonight with his stuff. You can come back, sort it out in the morning, you know, we'll be there to help you if need be. That's what they said. Came back in the morning and somebody just brought it back, with a bin bag tied at the top, and there's his stuff, and that was it.
Thank you. Could you read paragraph 57 of your statement, please?
This was a much worse experience than that of my parents if we had to compare them. He was only 59 and had the most painful of endings physically and mentally. It's hard to think how anything like this could be made worse, but the government restrictions meant it was so. I guess I want hospices to stand up and explain their actions at some point too. I can't even go there with the one that we experienced.
Thank you. Now, moving on to the lessons that you think should be learned. We have all of the points you've made, and we will take them all into consideration. At this point, I'd just like to highlight a couple of them.
Yep.
Yes, my Lord, this is the end of the... Thank you. Please, could you read paragraphs 58 and 59?
I am unsure of the word lessons. Why should my parents and thousands of others have been the lessons from which governments learn? Why should they be the guinea pigs? Government should and could have done better. My view is that surrounding residents of care homes with people wearing masks for such a long period had a huge impact on them. This, in conjunction with isolating them from their loved ones and everything they know, was catastrophic. I think one person should have been let in from the start of the pandemic, and there was a precedent for that happening in other countries like France. Why didn't we look at good practice elsewhere? I think the care home thought they were doing a great job by protecting people from getting COVID, but the other impacts on the residents didn't matter. They operated under a veil of fear, not care and compassion. My view is that I have spoken out, but nothing has changed. To feel so powerless and to watch as someone else took the decision to stop me seeing my own parents is devastating. I do not have any confidence that the Scottish Government will listen to anything, as they would not even listen to something as tragic as this. Even 6 months in, could the Government not have listened, realised the impact even then and acted? For me and other relatives, we cannot understand how somebody could come to the decision to place such severe restrictions on care homes, given the effect that those restrictions would have on dementia patients and over such a long period. Did the decision makers just dismiss them?
Thank you. Now, do you think you've been heard on everything that's important today?
I have some more notes. Wait. I know time is of the... we haven't mentioned Anne's Law, but I know that's been covered.
That's right.
I just want to say, you know, I only wanted to get in to maintain connection with my parents, to be with them, to help. I wasn't looking for an open door policy. And, you know, we were the safest people on the planet, the relatives, and to be dismissed so... It just gets me to the core. It really does.
You believe that relatives were integral to the well-being of residents, and that care homes should have worked with you.
Yeah. And we were willing to work with them. But we weren't even given that chance. And look at the effects now.
Yeah. Thank you.
Thank you.
Thank you. I don't have any.
Yes, thank you, Mrs. Bell.
Thank you.
Good. Just before 1:30. Thank you.
Mr. Gill.
Thank you, my lord. The next witness is Diane Montgomery. Her statement is SCI WT 0628 501.
Okay. Now, good morning, Ms. Montgomery. Please take a seat. Thank you. Now, Mr. Gill.
Thank you, my lord. Hello again, Mrs. Montgomery, I should say, sorry. Your full name is Diana Henry Montgomery, I think.
That's right.
The inquiry has your personal details and your contact details. You're a retired teacher.
Yes.
And you're here to talk about your husband, Ken.
Yeah. Yes.
You were married a long time. You were married for 45 years.
Almost 45.
Almost 45 years. And your husband died on the 24th of October 2020.
Yes.
And I think he was 69 at that time.
Yes. Yes.
And I think also, it was a matter of some comfort to you that he was able to die at home.
Absolutely.
Yes. Just tell us a little bit about your husband. I think he was also a teacher, but I think it's described as a guidance teacher.
He was a guidance teacher, yes.
Yes. And you had two daughters, have two daughters. We can name one of them. That's your daughter Lucy.
Yes.
And Lucy, particular reason we're naming Lucy is to give some context, is that Lucy is a doctor.
Yes.
And a lot of comments that you can make about your husband's illness and as it progressed and its progression is to a certain extent informed by other comments that your daughter has made.
Yes, absolutely.
You were also, as I read it, quite a musical family.
Yes.
You're a pianist.
Yes. And
Your both daughters are violinists.
well, I've got one a cellist, but she plays the violin.
Sorry.
And the other one is a violinist. Yes.
Okay. And your husband was an accordionist.
Yes. Yes.
Yeah. And I think really at all stages of his life, music was important to him.
Yes. Music and sport, yes.
And sport.
And sport, yeah.
Okay. He was also, I think, quite an active man.
Very, very active.
Very fit.
Very fit, yes.
And, I think it's paragraph 111. It's not necessary to look at this because it's towards the end of your statement. The one thing that was important to him was his family.
Yes, most definitely.
Yeah. And I think when he died, he'd become a grandfather. He was a grandfather.
Well, we had 6 grandchildren, yes.
Yeah, yeah.
And they absolutely adored him.
Yeah. Now, slightly on the darker side of things, your husband had a very aggressive form of dementia.
Yes.
I think it's called frontotemporal dementia.
That's right, yes.
And I don't think we need to go into any of the details of that, but you have provided us with some information about it. And that was diagnosed in 2016.
Yes.
Mm-hmm. And things became particularly difficult with his condition, as you tell us, in about Christmas 2019.
Yes, I did.
And the position was that in January of the following year, so just before the pandemic struck, your husband was admitted to hospital.
Yes, to the dementia ward at Glenwood Hospital.
Glenwood, yeah. And that was for initial assessment.
Yes, and to sort out his medication.
And I think at that time you envisaged that he would be coming home.
Oh, I did, yes, yes.
Yeah. But sadly that didn't prove to be the case.
No.
And to a certain extent, I think probably your daughter, with her medical hat on, was able to give you a little more realistic appraisal of the amount of care that your husband needed.
Well, yes, and the doctor said he'd put a CPR on Ken, and that was just, he'd only been there for a very short time, and he did say he was surprised I kept him at home so long.
Yes.
And I was shocked at the CPR, but my daughter said, "That's right, Mum, because, you know, he could never survive." And she said, "Anyway, he's so fit, he won't get a heart attack. That's not what's going to kill Dad." Yeah.
Yeah, and I think you talk about this at paragraphs 10 and 11 of your statement.
Yes, that's right.
And I think you say that you were told that it would be the dementia that would kill your husband.
Yes, no doubt.
Yeah. And thereafter, your husband was moved from the hospital, I think, is that right?
He wasn't moved to hospital until, he was in that hospital. And then lockdown came.
Yes, yeah. And as you say, lockdown was announced in March 2020, like we all know. And you weren't allowed to see him, and you didn't get to touch him for six months.
Yes,
Yeah.
sadly.
Yeah. And you tell us about the visits that you were able to have, such as they were, but these were involved seeing your husband through a window.
Yes, that's right. We made an appointment and we could see him through a window, but it didn't really mean very much to him. He once put out his hand and we couldn't touch him.
Was he able to recognize you?
I think at that stage he did, yes.
Yeah. And I think there was also, another thing that was offered was FaceTiming. But again, was that any use to him?
No use for Ken at all. He just, no.
Yeah.
The only thing that would be, face to face.
Yeah. And then eventually, as you say, in July 2020, you were allowed into the hospital. This is paragraph 17.
Yeah.
But you never got near him to touch him.
No.
And
it was only me.
And it was only you.
I was the only one who was allowed in, yes.
What was the basis of allowing you in to see him? Do you know?
Well, I think the rules had changed slightly by that time. And, I was allowed to see him at a distance. But only me.
Yeah. And your daughters weren't allowed to see him, as I understand it? Yeah.
No, they were actually never allowed to see him again until he came home to die.
Right.
Not through a window. My elder daughter, Lucy, she got to see him outside for 15 minutes a week, but not every week.
Yeah. You are very complimentary about the care towards Ken while he was in Glenwood Hospital.
I couldn't say a word against them. They were, we knew them all. They were very friendly. And when lockdown came, and they knew Ken as well, that was important too. And when lockdown came, someone who knew Ken. She'd been the psychiatric nurse's assistant. She did move into Glenodee, and you know, we were happy knowing that she was spending quite a lot of time with Ken, and that was a comfort to us that, you know, we knew that he knew her because she had taken him for walks sometimes prior to him going into hospital.
Can you tell us about that in paragraph 23? And you make a comment in paragraph 24, saying the staff in Glenodee were superb, never criticised them. But then you make a comment which I think is one we're starting to hear quite frequently. Perhaps you just read that last sentence, please.
On paragraph
24.
24. The staff in Glenodee Hospital were superb. I would never criticise them. It had nothing to do with the staff and everything to do with the rules.
At that time, Mrs. Montgomery, what view had you taken about the restrictions that were being placed on your ability to see your husband?
Well, it actually got worse later on because the longer it went on, the worse it seemed.
I appreciate that, but I'm trying to get it just at that early point in time.
Well, I guess we didn't think it was going to last for all that time. That's number one. We thought it was a very temporary sort of measure. And as I say, as it went on, it got far worse because you realise that this was not just having a short time. No, we didn't like not being able to see him, obviously, but we didn't know that worse was going to come.
Right. He was transferred to Deeside Care Home.
Yes.
And I think that was a decision that was made, but without reference to you.
Yes, I mean, I was just told that I understood he had to be moved because he'd been in hospital longer than would be normal if it hadn't been for lockdown. So I knew, and I also knew that for my safety as well, he couldn't come home, sadly. And my daughters were worried about me as well. But I was just told he had to move, and he had to go to an EMI unit, not just a care home, but a nursing home, really. And they had found one, which I don't think I'm allowed to name, and I think it is named.
You can.
Yes, Deeside Care Home, and that we would have to pay £1,850 a week, and then for 2 years. And when I asked what happened if we couldn't afford that, I was told, well, he could go anywhere. And in my naivety, I thought if he was close, I could go and visit him every day. This is what I envisaged.
And an EMI unit, as you say in paragraph 29 of your statement, is a specialist unit.
Yes. It's
for people with a specific type of dementia.
Yes. And I think it's important to say it wouldn't necessarily be for older people. You know, people think dementia's older people, but it's not. The more aggressive forms are actually in younger people.
And your husband was in his late 60s.
He wasn't, and he was, apart from having dementia.
Yes.
Fit.
Yeah. I think your doctor daughter was able to effectively give you some advice about Ken's life expectancy.
Yes.
And I think that was to the effect that he wasn't going to live for more than 2 years.
Yes, I think both our daughters, you know, knew that although I had to be able to say I could pay that every week, they knew it wasn't going to last that long. And I think if I had known that he wasn't going to live as long, I would have asked if I could go in and pay the fees just to be with him. If I had known that he was going to be treated the way he was, I would have paid and known I could afford it because it wasn't going to be for very long.
Yeah. You say that in paragraph 32 of your statement.
Yes, that's right.
Yeah. But unfortunately, as you say in paragraph 33, you weren't allowed to be near him.
No, I wasn't allowed to be near him when he went into a place he'd never seen in his life before, never met anybody there before.
Again, the transfer of him into Deeside Care Home took place in August 2020.
That's right.
And you said these points, but you weren't allowed to be with him when he was actually physically transferred into the care home.
I thought I would be allowed to take him, but no, an ambulance took him, and I was not allowed to be near him.
And do you know what the basis for that restriction was?
Well, I don't really know, because I guess he was being tested at, at the hospital, and I don't know. And then he was put into isolation for 2 weeks.
You say at paragraph 37 that you were actually able to see him being transferred, and
I decided to drive down to the home and wait outside till he arrived.
Yes. And you could see that he was smiling, at least.
Well, he was. I mean, I took a photograph of him the day before, and he was looking really. I saw him the day before, and he was looking really quite healthy, and knew my name, I think. And well, I just, I wasn't allowed to be near him. That's the thing. I just saw him go in. He smiled at me, as he always did, and well, that was a fortnight when we had no contact other than a failed Facebook. And he spent his birthday, not Facebook, FaceTime, and he spent his birthday, his last birthday, in total isolation.
You did manage to hold up his accordion for him.
Well, I handed the accordion to the people. Well, I left it at the door, and I think it would have been put away for isolation. I don't know if he ever, I just don't know, because I never was inside the place, so I don't know.
Yeah. But he was put into isolation for 2 weeks, as you say. Notwithstanding the fact that he was there, you say you didn't actually meet the carers and the nurses there.
I just met them outside. I didn't see inside the home or anything like that. And he was put into isolation for 2 weeks, and we don't know what went on, but he was used to walking around. He always did. And then when he was in Glenaddee, he walked around. And there was him just confined to one room with, I don't know, but we just don't know.
Right.
And on his birthday, we arranged a FaceTime, but it was just so awful. And he looked so awful. And I phoned his twin brother and said not to FaceTime him because it wouldn't do any good. It wouldn't. It would just upset him because he had not been allowed to see him either.
I think, again, please don't name his brothers, but I think he had a twin brother and another brother.
Yes, that's right.
You did have difficulty communicating with nurses on the phone. Very often it just wouldn't be answered, as I understand.
Well, yes, and when the care inspectorate went, because I've written to them as well as everybody else, the day that we knew he was dying, they actually visited, and then they went back to do an inspection later on, and found there was only one main phone, which was why it was difficult to get through. Yeah.
Right. Okay. You say that you wrote to the care inspectorate.
I did.
And others. And I think you had become quite a corresponder at this time.
Well, yes, I sent over 100 emails to different people, just trying everything to get to see Ken.
Yeah. And I think the one thing was that the care home wasn't that far from your home.
Yes.
And you envisaged, I think, that you would be able to go and see him in the care home, have cups of tea with him, spend time with him.
Yeah.
But as you say, this never materialized.
Never. No.
Yeah. How was the restriction or the isolation of your husband, how was that communicated to you?
Well, I think we knew before he went in because we were told he would be isolated for 2 weeks. We didn't really fully understand why, I think, but we were told that, yes.
You say at paragraph 45 of your statement that you think the isolation is why he deteriorated so quickly. He was kept in his room, confined to one room. How did you appreciate the extent of his deterioration?
Well, you know, I would phone most days, and if I didn't phone, either of my daughters would phone. And I think it was, now I can't remember if I phoned or they phoned me. He got a UTI.
Yeah.
And I would believe at that point I should have been allowed to be in as an essential carer, because I know he'd have been very distressed. And he never had a UTI in his life before. And I know I would have picked up the signs, you know, I would have known. So he got 2 UTIs and he lost weight. Everything went wrong from then on, really.
And your contact with him at this time was, I think, restricted to FaceTime, is that right?
Well, we didn't do FaceTime anymore because what was the point?
Yeah.
He couldn't understand any of that.
Yeah. So you weren't able to physically see him?
No.
Okay. And obviously you feel that had you been able to see him, you would have recognised the changes in him.
I definitely would have, because I knew when he needed the toilet. I knew, you know, he got agitated, and I would have known there was something wrong with him. I have no doubt about that at all.
Okay.
And I tried everything to get to see him.
And again, you tell us that you really had very little idea of what life was like for him in the care home.
No idea. No, not really.
When and if you did get through to the nurses at the care home, what was their comments about Ken's condition?
Well, they would tell me roughly what he was eating and things, and I remember one of the nurses said she told him he was a handsome man, which he was. He was very handsome. She'd been cutting his toenails, but I did notice when he went into the hospital, his nails were very long, in fact. I particularly noticed that. I took a scissors in to cut them, but that's for later on, I guess. Yeah. Right.
Paragraph 58 of your statement, you found out that you could get a 15-minute slot to see him outside, and
Yes.
that you could take your daughter Lucy with you.
Yes, but nobody else.
Yeah. And that was after the 2 weeks of isolation.
Yes.
Yeah.
Well, sometime. I'm not sure exactly, because Aberdeen had a COVID outbreak. And
Yes, well, you mentioned that in 59, the football team in the pub.
Yes.
Yeah, and as you say, that...
It punished everybody, yes.
Yeah. And so you had 15-minute visits with him once a week. They had to be arranged in advance and were supervised.
Oh, yes, we knew we couldn't touch him, you know, but we were supervised all the time, yes.
Yeah. And you knew that if you did touch him, then he would have been put back into isolation. You phrase it as he would have been punished.
Yes,
Is that how you saw it?
We did see it that way, yes.
Yeah. Okay.
We wouldn't have dared touch him.
Okay.
Because he would have been punished, not us.
Yeah. You also mention being able to see Ken outside, but again, this is again a recurring thing that we're hearing in this inquiry about. Well, you were in Aberdeen. Scottish weather is not known to be particularly clement at that time of year.
And we got a real shock the first time we saw him, because he had deteriorated so much since I had taken the last photograph at Glenwood. and you know, he had a hat on, and he was wheeled out in a wheelchair, and I mean, Lucy just burst into tears because it was just so horrible to see her dad so deteriorated, you know.
Yeah. The deterioration that you noticed then, can you just explain what that deterioration was?
Well, he was wheeled out in a wheelchair.
Yes.
I think that was quite a shock at the start. And, you know, we didn't really feel he was with us, not really. You know, what he needed was a hug, you know, or a hand touch. And no, we just didn't get any of that at all.
Did you feel his cognitive functions had deteriorated, or were they the same, but there was an issue about him not being able to have any physical contact with you?
He wasn't smiling anymore. That was, you know, everybody, you know, all the letters that were written afterwards, they all mentioned his lovely smile, and he wasn't smiling, and he just looked utterly, utterly miserable. And it was a real shock to us, I think, to see him like that.
Yeah. And that was particularly upsetting. Well, it would be obviously upsetting for you and for your daughter.
Very upsetting. And to know we couldn't comfort him, you know, that was the awful thing.
Yeah. Did you receive any indication from the care home that your husband was deteriorating?
I wouldn't say so. I mean, our daughter wrote and said, because there's a scale that he was on sort of the middle when he went, you know, when he left Glenadee, and Lucy kept saying he's deteriorated, and they just denied it. But we knew he had, because we saw him outside for 15 minutes.
I think things progressed, as you say, in paragraph 66, when there became difficulties, he had difficulties swallowing.
Yes. Now, we weren't allowed to see him the week before that.
Yeah.
I tried and tried, but apparently, even though we were paying all that money, we were not allowed to see him every week. So we didn't see him that week. And then on the Saturday, my daughter phoned the home, and she was told by the nurse that he couldn't swallow. And that is a sign that things are imminent. You know, people can't live.
Your daughter would know that.
Yes. And I then wrote to the... I'm sorry, drink some water.
Please.
I then wrote another email to the manager to say that we didn't know what we were going to find on the Tuesday, because that was a fortnight since we'd seen him. But we could only imagine it was going to be just awful what we saw. And of course, we were proved right. But my daughter was driving, and we went in. And on the way in, the nurse phoned and said, oh, don't worry, but, you know, your husband's not very well today, so he won't be able to come outside. And I thought, oh, right, okay. So we went in, and Lucy parked the car, and we went down, and obviously we weren't allowed to see him outside, so we looked in at the window. And the first thing I saw was that he was so distressed. But Lucy saw his breathing, and she knew he was, you know, he was not able to breathe properly. But we still weren't allowed inside, incidentally. We still had to look at him from outside.
Just taking a slight step back from that, I think your daughter had mentioned the possibility of essential visiting prior to that.
Yes, we had both done that, yes.
And
but we were told he hadn't deteriorated, you see, that's the thing.
So we've heard that one of the criteria for allowing essential visiting was end of life.
Yes.
Was that at that time when Ken's swallowing had deteriorated, his breathing had deteriorated?
Yeah.
Was that deemed by the care home to be end of life, do you know?
Well, they certainly didn't tell us. I mean, the GP contacted my daughter and said he was going to push for a letter. He was going to write a letter pushing for me being an essential carer. And then the day that he was... Oh, I should have mentioned as well that our younger daughter and his twin brother were not even allowed to see him through glass. And, I mean, my younger daughter was totally distraught when she was told that. So going back to that day, yes, we saw him. I had written another letter, but at no time was I allowed to be an essential carer. Now, on the morning that we were going in to see him, the care inspector had phoned me and said they were going to visit the home that day. And, you know, I don't know, it seems to me a funny coincidence that on the day that Ken was admitted to hospital, I was then told that they had decided to make me an essential carer.
Yeah.
But I think it came from other sources, you know. It probably came from...
You tell us that in...
yeah,
I'm sorry.
Yeah.
You tell us that at paragraph 78 of your statement.
Read the end of it.
Yes.
Yes, just the last sentence.
Well, no, I'm saying you tell us that at paragraph 78, that
yes,
you were
that's
given
right.
essential carer status.
Once he was in hospital.
And it was
yes.
a bit late.
A bit late.
Yeah.
Yeah.
And I think also, perhaps with the bluntness that doctors are perhaps known for, your daughter did tell you that in her view, your husband, her father, was dying.
Dad's dying, yes.
Yeah. Now, he did go to hospital.
Yes, he was taken to hospital. We were never allowed inside the home, ever. Right. He was taken to hospital. They had phoned the doctor, and it was, I think, a paramedic who came, and he was taken into hospital with aspiration pneumonia and dehydration.
Yeah. And I think he was, well, you don't know if he was tested for COVID before he was transferred, but you presume he had been.
Well, I don't know whether they were tested, but he was tested in hospital when he got there.
Yeah.
And we weren't allowed to see him until he was, you know, tested. And the consultant understood that they were having difficulty getting a test, but they understood that I would be able to help with that because obviously I knew him. Yes. But actually they managed to get it anyway. Yeah.
Just in relation to his admission to hospital, if you go to paragraph 77, he was admitted to Aberdeen Royal Infirmary to begin with.
Yes, he was.
And then thereafter he was admitted to Wood End Hospital.
Yes.
And I think in paragraph 77, you were allowed to go to the hospital to see the consultant.
Yes, and
Lucy, that was you and your daughter Lucy.
And Lucy was allowed as well, yes.
And the consultant said something to you which I think you've noted and remembered. And could you just tell us what the consultant did say to you? Well,
he was really so empathetic, and he said that more people are dying in homes because they're not allowed to see their loved ones that are dying of COVID. Words to that effect. I mean, yes. I think those were the words, but something like that. Yes. Yeah. And he understood. Yeah. Very, very empathetic.
Yeah. And paragraph 81 of your statement, you were talking about the testing and that your knowledge of your husband would enable you to assist in facilitating the testing.
Yes. Yeah. I didn't actually have to, but he recognised that I would be the person who'd, knew him, obviously. Yeah.
And again, that was something that the consultant agreed that would have been helpful.
Yes.
And he agreed that it would have made sense.
Yes, he did.
And you say at paragraph 82, I think, commenting on that indication from the consultant, that was somebody who understood.
Yes.
Just read on that paragraph, please, Mrs. Montgomery.
Someone who understood. The government never understood that actually people need their loved ones. They can pick up on things that other people can't. And that's especially true with people with dementia.
Right. In the hospital, you and was it one daughter or both daughters were able to see him?
One daughter at a time. My daughter was obviously there when he elder daughter when he went to hospital. But my younger daughter came up from south of Scotland. I mean, it was great because our in-laws came to look after the family, and she was allowed to see him, and she used the word euphoric because she thought she'd never see her dad alive again because she wasn't allowed to see him through a window. Yeah. And, you know, there he was sitting there and he was looking just like a different person, actually. I know it sounds strange, but he had an antibiotic drip and a drip for, you know, rehydration.
Yes.
Yeah. And he was sitting there smiling, and, you know, he definitely knew us. I mean, there's no question about that. And she used the word euphoric, yeah.
Yeah. And you were able to have visits with him.
Yes, we were.
In the hospital.
Yes.
And your daughter Lucy did come to see her father.
Yes.
Although by the time she got to see him, he wasn't looking as good as he had been earlier in the day, as you say.
My younger daughter came in the morning with me, and, you know, and then she was working in the morning, so she came in the afternoon, and, no, in the evening that was, and he wasn't quite as bright as he'd been in the morning.
Right. You as a family, I think, wanted your husband to be able to come home to die.
Yes, we did.
Yes. And I think you communicated that.
Yes.
Yes,
we did.
To the hospital.
Yes, and a nurse spoke to us about that. Yeah. Yes.
And he was transferred from Aberdeen Royal Infirmary after a week to Wood End Hospital.
Yes. Yeah. Yes.
And you were again there allowed to see him as a family.
Yes, and also his twin brother and his other brother were allowed to come and see him at different times too. He was put into a separate room.
And I think it may seem a small thing, but you've mentioned it twice. He was able to indicate how strong his legs were to you.
Yes, he did, because he was so sporty, and he was, you know, lifting his legs and things, showing how strong he was. Yeah. So we got to see that, at least, you know. Yeah.
The problem, I think, was that there was a difficulty in getting him to swallow and to eat.
Yes, and they did have a speech therapist to try to help him with that, and they tried all different kinds of things, and and I tried to help that as well, but it really was to no avail. He didn't make any difference. Try as they may.
But arrangements were made for a hospital bed to be installed in your home, and and carers also coming to the home.
Pleased to,
and I think you did write, presumably after the event, to both Wood End and the Royal Infirmary, thanking them for what they did.
I wrote to both because they just couldn't have been kinder, and it made the world of difference to us, and I believe to Ken as well, just to be with his family.
And I think what you say at the bottom of paragraph 94 tends to suggest that you had rather given up on humanity at that time.
Yes, I think that's fair to say. Yeah.
Okay. Your husband was brought home, and his children were able to be there.
Yes, and grandchildren
as well.
Yes, and they were playing the violins, and he was keeping time to the music, and and I gave him some ice cream as well that he really liked. It was just lovely to have him home.
Yeah. And I think, as you say in paragraph 96, you were all thrilled that he was back home.
Yes, we were. And he was smiling, and it was just wonderful to.
But you obviously knew that the end was nigh.
Yes, he came home. I mean, they stopped his drips when he went into Wood End Hospital, because we knew there was no way forward. And so we knew he was coming home to die, and that's what we wanted, and we knew he had wanted as well.
Yeah.
Yeah. And so we were lucky that way.
Yeah. And you say that he died in the morning. Your daughters had been able to spend time with him.
They actually slept on the bed with him. They're both very slim, and one slept on one side and one slept on the other.
They fitted
last
in.
night
Yeah.
in the hospital bed,
Yeah.
yes.
And you say you feel extremely lucky.
I do. I think the girls keep reminding me, they say, but we got him home. Because every day I go through, what could I have done? What could I have done? And but they say, but we got him home.
Yeah.
To die for him,
Yeah. And you say that was really down to the compassion of the hospital.
Well, yes, it was. Absolutely.
Right. So far as bereavement is concerned, you make some observations about that. You were allowed 20 people at his funeral.
Yes.
And you say that was okay for you.
That was okay for us because, it was all the sort of close family who were there and friends. If it had been 40, it would be more difficult because we'd have had to invite people and then people would expect that we expected them to come if we asked them. So actually, that was fine for us. And, I played the piano and the girls played their violins and they did the eulogy as well. And his twin brother did a reading as well. Yeah.
Right. The paragraph at the bottom of that section, 102, which perhaps isn't a necessary, so it's like non sequitur from what you've said, it may not be, but you say, I do think that human rights were completely obliterated during COVID.
Absolutely.
Now, I don't want to pull the lawyer on you, Mrs. Montgomery, but obviously human rights is a very complicated area of law for all of us. What did you see as his human rights being obliterated, or your human rights being obliterated?
Well, I think everyone has got the human right to be close to the ones they love when they're dying. I mean, I just think that's a basic right that everyone should have, and not to be treated like you just weren't a person. Yeah. A basic human right is to be able to be with your loved ones, and that was absolutely taken away.
You tell us a little bit about the care home relatives group,
Yes.
of which you are still, I think, a member.
Yes. Well, I came out of the group when Ken died because I felt, but I was always in contact with them still. Yes. And without them, I think I would have, I don't know, they were just such a saving grace to me personally.
A comfort to know that other people were in the same position.
It was a great comfort, yes.
Yeah. Okay. And can we just look at what you say about the impact? And again, much of what you say are things that we are hearing repeatedly.
Oh,
so
right, yes.
Please don't think that in any way we're dismissing them. But you, first of all, in paragraph 106, say that the impact of visiting restrictions at the care home on you and your family was pure hell.
Absolute hell. Yeah.
And you talk about the impact really that had on you. Your daughters were crying all the time. Mm-hmm. You were sending emails to people at different times and you were desperate.
Yeah.
And you say that nothing was done.
No, we discussed what else we could do, and then we thought, well, I had done everything I could, and, they had done everything they could. And we thought, well, we would go to a solicitor because, would they be able to do anything? But kind of thinking probably not. It was just a desperate situation that you could not see your own husband and father
You used the word, I think, in an earlier part of your statement, as feeling impotent.
That's exactly how I felt, yes.
Yeah.
Because none of the things I did had any effect whatsoever.
You say at well, would you read paragraph 108, please?
I personally will never be at peace until I die, because all the time it goes through my mind, what could I have done differently? The girls will say to me, I did everything I could. There's nothing else I could have done. But there isn't a day goes past when I don't think, what else could I have done? How could I have got my husband, you know, be able to be with my husband?
And perhaps there's a balance and a comfort. Your daughters do say, but we got him home.
Oh, that's a great comfort, yes.
Yeah.
And I know that we were lucky that way, because many people were not allowed to be with their families.
Could we go to the, I'll pass over the inspections, if I may. Could we go to the lessons learned? And you make a number of points, and again, these are points that we are hearing from other witnesses, and please don't think that we are diminishing them. We're hearing them again from you. But you say that isolation you think is a euphemism for solitary confinement.
Yeah, for people who've never committed a crime. I think it is a euphemism, because it's just, I just can't describe how horrible it is, you know.
You also make the point, and you made it earlier in your statement, about the fact that you, as you see it, the government failed to recognise that one size does not fit all.
Absolutely.
Explain that, please.
Well, I think that they were unaware that, firstly, it wasn't just older people in care homes, you know, and that I sadly know this now. I knew nothing about dementia before, but there are over 100 different dementias, and they're all so different, and everybody was just put into this sort of, just the same kind of category, and no thought for individuals at all, you know. It's just, and people with the kind of dementias that Ken had, you know, you can't explain to them what's going on at all. You know, we weren't allowed to explain to them. We weren't allowed to hold their hands or touch them in any way, and that's all they needed. And the government just didn't recognise that at all, that some people, and Lucy actually wrote in her letter, she said, you know, that all Dad needs is the touch of his wife or somebody in the family. That's the only thing he can understand. She wrote that down in the letter.
Yeah. You also set out in, well, sorry, before I get to that, just one other point. Paragraph 123, you make the point that rules cannot be applied uniformly.
Yes, absolutely.
So that implicit in that is that the rules should at least allow for individual personal circumstances.
I believe so. Yes, I do.
Yeah.
And also just the recognition that the people who actually have got the most interest in their families are the families. You know, I mean, we were not allowed to touch Ken at all, but everybody else could touch him. And I went home to my home on my own, and my family up the road, they were my bubble, but they were testing all the time, as I was. And yet everybody else who was there could touch Ken, and then they could go home to their own homes where maybe somebody else had been working. You know, it just didn't make sense.
Yeah.
No sense at all.
Yeah. The hopes for the inquiry, I think these really do reflect the points you've been making. And I think importantly, you say at 125 that just saying, well, rules are rules and we don't really care about you. They apply to everyone, no personal circumstances. I think that if something like this happens again, they will have to make a different approach.
Very much so, yes.
And that, I take it by that you mean that the approach should be more person-centred.
Absolutely, yes.
Right. I think you also say that, perhaps reflecting what the consultant had said to you, that people were dying and having been deprived of the contact with their loved ones.
Absolutely, yes.
You've also asked, or say it would be nice, were the government to give an apology to people who are in your situation.
I would very much welcome that. It doesn't bring people back, but I think there should be a recognition that what you did was actually wrong, to just apply a rule to everybody, regardless of circumstances. Mm-hmm. And I really think that the people who are least likely to bring COVID into a home were the relatives, because they were taking extra care. Mm-hmm. And they were not mixing, well, they were not mixing with other people. Mm-hmm. No.
Yeah. Just, if you can, Mrs. Montgomery, can you read out paragraph 128, please?
Yes. I was married to Ken for almost 45 years, and the rules took away my ability to touch him and comfort him for the last 6 months of his life. All of the care staff who were going home to their families every night were able to touch Ken, but none of his family members, the people who were most important to him, were able to be near him. Ken was dying of dementia and was totally isolated from everyone he loved most. My hope for the inquiry is that they ensure that people living in care homes like Ken can never be completely isolated from the family again.
Thank you. You've indicated that you wrote over 100 letters complaining about the situation, if we can put it that way.
Yes.
Can I say, Mrs. Montgomery, that I and my team will be asking through your solicitors for access to, not perhaps all 100, but some of them, yes. So that they can inform what we're doing yes. beyond the terms of your statement.
Yes.
But beyond that, Mr. Montgomery, is there anything else you would like to say to the inquiry?
Well, I'm very grateful that there is an inquiry, because I think that people need to know what pain it caused to people not being allowed to see their loved ones. And, we can't even know how much pain it caused to them, because, we weren't allowed to be near them. We didn't. I just, I don't know. We just saw Ken sitting in a chair and he didn't see us at all. That's just reality of it, and that cannot happen again. So I'm very grateful that there is an inquiry.
Right, Mrs. Montgomery, thank you very much indeed for your time.
Thank you very much.
Thank you, Mrs. Montgomery.
Thank you.
Very good. Usual refrain, yeah. Mr. Gill, is there any chance of advancing the next witness?
I'll have to ask whether the witness is here, my lord.
But
if she is, then yes.
If we could start earlier, that would be much appreciated, and probably everyone would appreciate it on Friday, I suspect.
Yes.
Very good, right. I won't fix a definite time then, but sometime between probably about 20 to 1, 22, I beg your pardon,
20 to 2 and 2 o'clock, yes.
We'll try and get that information.
Be flexible. Yes,
Thank you.
Thank you.